Thank you, Madam President. I rise in support of a Minnesota Health Exchange, and I have been for a Minnesota Health Exchange since the beginning. And yet, when we went through the Senate process just a week or so ago, I voted against the final bill and now just voted to send it back to conference. And I did so because there are elements within the final conference report that I strongly disagree with. I strongly disagree with the active purchaser part of this. I believe that if we set forward criteria upon which products and providers and carriers hear that this is what we're looking for when it comes to price and offering and benefit set, then we owe it to those carriers to allow them to participate in the exchange. Yet I am mildly pleased that we made one concession with regard to that in the conference report, and that is the first year. So in the first year that the exchange is in existence, all of our carriers may put products and offerings on the exchange, and I think that is a first step. And I'm actually hopeful that in doing that, that we will begin to lay the groundwork for a different kind of process in the future. And I say that because I don't think this is the final step. I believe that we have tackled a sweeping piece of legislation, and that it's all right to come back at it if we think certain provisions we pass don't work. And so the active purchaser was one I felt strongly about. The other one that I feel very, very strongly about is the fact that our carrier community does not have, in my view, a seat at the table. And I think we in Minnesota have a long-standing tradition of including our carrier community as we've tackled health care reform. I remember years gone by when Senator Berglund would stand up and speak about the compromises that came forward by having the broadest group possible at the table. And I believe in that, and I believe that we are a divided Minnesota when we identify one group and, in essence, label them as not able to be an equal part of this discussion. And so I didn't think that that was in keeping with the values that I hold true when it comes to enacting legislation that has such impact on our entire provider community and carrier community. The Affordable Care Act, you know, is really a game changer, and many things that are included in that, while I think are important, like the no longer being able to have pre-existing conditions and making sure that everybody has insurance. Those are very important provisions. They also bring a great deal of uncertainty to our carrier community in terms of their business model going forward. So anything we can do to make sure our carrier community, and I am proud as a Minnesotan that we're a nonprofit state, that our carrier community is in partnership with us, and for us to send a strong message to them that we appreciate their willingness to deal with these uncertain times as our partner. The way the conference committee report came back, that change was not made, and I'm disappointed. With regard to the fee structure, I'm concerned, particularly when I hear that the products, if the same product is offered in the exchange and outside of the exchange, then it's the same price. Then to me, really, the premium withhold is a fee on all the products, and I would have preferred a different version than that. But at the end of the day, having voted no to the first bill and then no to or voting to send it back to conference, those were my opportunities to change the bill before us. At this point, I no longer have that opportunity. All I can do is decide, am I still for an exchange or am I not? And so I'm going to vote for this exchange, and I'm going to vote for the exchange because I think it's important that we continue this dialogue, that we stand strong for a Minnesota exchange, and then that we be open and willing to work with it as the process goes forward. And so I'll be watching closely. I'll be giving input. I certainly gave enough input in the week between the passing the bill off the Senate floor and the conference. I used every avenue available to try and exert influence, and again, fell short in terms of my overall goals and objectives. But this is about something so much bigger. This is about a very large, sweeping change in healthcare delivery. Cost side of things, we need to tackle, and we need to do that together, and I'm hopeful that we will do that in partnership with all who are stakeholders in this important conversation. But for today, this is the bill that we have. This is the compromise that came forward out of the conference committee, and so because of that and my deep respect for this process, I will be supporting that conference committee report.